Substance use and addiction can contribute to the development of mental illnesses that affects a person's brain and behavior, leading to their inability to control their use of substances like legal or illegal drugs, alcohol, or medications. Here to discuss more on addiction is Dr. Shawn McNeil from LSU Health Shreveport. Let's get right to it, doctor. Do you feel like addiction is considered a mental illness? And if so, and if not, tell us more.
Right, so addiction, I mean, it certainly affects the brain and it affects behavior. And there's a lot of interplay between addiction and what we think of as more typical mental illnesses. So my primary clinical work is on a dual diagnosis unit. And what that means is it consists of patients who have a substance use disorder and a mental illness co-occurring. And again, like there's a lot of interplay. So sometimes a person might be using substances in order to self-medicate for a mental illness. So they might be very depressed and use substances to treat themselves. And then sometimes the substances themselves are what cause mental health symptoms to develop.
How do you think that society views addiction?
I do think that there is a lot of stigma, just as there is with all mental illness, including in our community. So, you know, a lot of people believe that addiction is the person's fault and that it is a choice. And while there is some element, especially at the beginning of the illness, where you do decide to use that substance, once addiction takes hold, I believe it is a mental illness. I believe that it's beyond the person's ability to control the disease process at that point. And so it becomes something, it becomes a condition where you need help to get yourself clean and sober.
Doctor, what are some of the signs that someone is needing to seek help? What are some of those?
Well, you know, if their personal life is out of control, if they're not able to perform well at work or at school, and of course if a person is so intoxicated that they're not able to function, there are many circumstances where you need to seek help right away and get that person detoxed off of the substance. And seek the help of really an emergency room at some points.
What should individuals do if they do suspect their loved ones or their friends? What should people be doing? How do you have that conversation with somebody, more importantly? Sometimes it can be uncomfortable or awkward, or maybe you don't know how they're going to react. How should people address this heavy topic?
So it can be a difficult conversation, and it's often a conversation that families will have many times with someone who is addicted. So again, if detox is needed, I would get that person to an emergency room or to a program that specializes in detox. But otherwise, you have to find out what that person is willing to do. Are they willing to go to a residential rehab where they'll go stay there for 28 days? Or maybe if they're not willing to do that, would they join AA or NA meetings? So you really have to find out what that person is willing to do in order to further their own health care, but generally getting a professional involved would be a good idea.
What should individuals do if they're not willing to do any of those? Say I'm the person who doesn't think that I have a problem, and I'm not doing any of those because I think everybody else is crazy and I don't have that problem. What should those people doing around them do in those situations?
Right, so you know, I would say if a person's addiction causes them to become a danger to themselves or a danger to other people or gravely disabled, then you can go ahead and seek immediate help. You can call the police for a well check. You can reach out to the coroner's office if you believe that person needs to be committed or, you know, evaluated in an emergency room. So sometimes those are the only options because the person who's using the substances are just unwilling to get any other kind of help.
Well, thank you so much, Dr. McNeil, for being here today with me and talking to me about addiction, those signs to look forward to, and how we can help our loved ones if they are battling addiction.
All right, thank you for having me.
Thank you.